According to a 2016 report, the rate of new malaria cases has dropped by more than 20% globally between 2010 and 2015. But the African region still accounts for the majority of cases. The death rate is also falling, but the disease still remains a major public health threat. Joining us now is CEO of Goodbye Malaria, Sherwin Charles, to talk to us more about it. Sherwin, good morning.
Good morning.
And thanks for your time. I'd like your response to what you just saw there in Natalie's piece and just the progress that's being made in Europe when it comes to tackling the disease and just a comparison of what we're doing in Africa where we're most affected.
Yeah, I think there's been amazing progress made over the last 5 years, as you saw in the report. Europe obviously has managed to eliminate malaria. They considered malaria-free and not endemic countries. Africa, sadly, still contributes more than 90% of the cases of malaria globally, and probably about 75 or 80% of the deaths globally, and most of them occurring in children under 5.
So why? How is it that Europe can declare itself malaria-free, but we can't seem to get it right here?
I think it was a question initially of resources, effort, and the implementation of programs. In Africa, obviously, there are many challenges to malaria control and malaria eradication. We in Southern Africa are really at the forefront in the SADC region of eliminating malaria. We have possibly 3 to 4 countries that could do so in the next 5 years. It's very, very important for us that we highlight what needs to be done, that we encourage our governments to invest in ending malaria, and that private sector like ourselves get involved in PPPs with government to assist in getting rid of the scourge.
Well, you speak about reminding people what needs to be done. What exactly needs to be done? What are the challenges we need to overcome? And I'm sure poverty and the challenges of Africa alone play a big part in why resources are not getting to where they're going. Also detection, probably another problem.
So a lot of the elimination efforts that happened in the Northern Hemisphere was really around economic development as well. So when houses put up aluminium sidings, when you got shutters and curtains and everything else, it does assist in a way. But the big thing for us to do here in Africa right now is to ensure that we understand the disease is prevalent in our country, is to take precautions when we travel to endemic countries, and is to ensure that we do the simple things to control malaria. Now, the recipe is known. The interventions are there. So really the successes have been achieved by the use of indoor residual spraying, by the use of bed nets, by treating only those who have malaria, so proper detection of cases. And in that regard, there's been a rapid diagnostic test that has been developed over the last few years that has been very effective in case detection. And then obviously ensuring the correct treatment is available. Malaria is a disease that can be totally eliminated. The answer is there. It's a question of effective and efficient implementation.
And yet we still see a child dying from malaria every 2 minutes.
Yes, sadly that is the case. So I think Goodbye Malaria really started by us saying that in Africa, we understand what our challenges are. We understand how to overcome those challenges. So why don't we stand up and take account for implementation in Southern Africa? So we started the program in Mozambique in 2013. We've had incredible results, impact of reductions of over 70% in the areas in which we work. That has had an impact then on South Africa and Swaziland, who are 2 countries very close to elimination.
So where are we? I mean, we saw the piece, we saw what's being done in Europe, and where are we in sort of sharing sharing their research, sharing their results? Are we left to do our own on the continent here? What are the efforts to collaborate and help in this?
WHO are really the most important party in terms of the collaboration. They write the rule book for malaria elimination. They really provide the guidelines to countries in Africa on what needs to be done. That is very clear and it's well set out. South Africa has made great progress. Obviously, Southern Africa has had a challenge over the last malaria season, which really starts during the rainy season. We've had lots of rain, so we've seen a spike in cases of malaria in Southern Africa, something that's a bit disturbing, but something that we are in control of. We need to address that. We need to keep our foot on the accelerator. We in South Africa use IRS very, very effectively. We need to continue that. We need government support for that and government funding for it. It's not a high burden of disease in the country, but imagine the great story we could tell to say, come on holiday to a malaria-free South Africa. It gives you lots of comfort.
One less thing to worry about.
Exactly.
All right, thanks very much for that, Sherwin Charles, the CEO of Goodbye Malaria, talking to us today on World Malaria Day.